Hello guys, what's up and welcome back. This is Everything Health with Nurse Dara. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I'm a registered nurse, registered midwife, registered public health nurse, and a Bachelor of Nursing Science degree holder, currently practicing here in Nigeria. So today we are going to be discussing a very interesting topic: the connection between family planning medications and infertility. Does family planning medication cause infertility? That is, contraceptives, do they cause infertility? I've gotten this question from a lot of women in my comment section from my previous posts. I have some of them here and I'm going to be reading them out because seeing so many comments like this prompted me to make this video today. It means a lot of people are concerned about this, so I'm going to read out few comments I got regarding this. I got most of these comments under the post I made about Clomid. That is why they are asking about using Clomid to counter the effect of this family planning. So the first comment I got here is someone was asking, can Clomid help someone who could not conceive because of the effect of the injectable family planning? I got another question saying, hi, have been using 3 months family planning silage. I've used it for a year now, but I've not gotten pregnant. What might be the problem? Another question said, can you take Clomid after the 3 months family planning is due? I want to get pregnant. Another person was asking, I used 5 years implant for 3 years, and since I removed it, I've not gotten pregnant. What could be the problem? Another question, please, I have a problem of rectum and I've never conceived, and my period cycle is after 21 days, have never aborted, but have used emergency pills not less than 5 times. Can I conceive? Another person asked, can someone who had family planning but has stopped since 2 years ago but not getting pregnant, can I take Clomid? So this same person went ahead to explain. She was like, to be specific, I used Depo, the 3 months injection, that is Depo injection. Another question, I think I'm just going to paraphrase this one. She said, according to her, she was using this 5 years family planning but started having series of side effects from the 5 years family planning that she was on. So she had to remove the family planning and then continued with pills. That is, she removed the 5 years family planning, which is obviously implants, and then continued using the oral contraceptives, that is the pills. She was still having some side effects as well, so she stopped. Now, according to her, her menstrual cycle returned after some time, but have since struggled to get pregnant. So with this, you can see that a lot of women are concerned about this family planning and the effect it have on fertility, and that is the topic we are going to be discussing in this video today. If you're interested in this topic, keep watching. We have different types of family planning methods. We have the natural methods, where we have the calendar method, that's tracking your ovulation, the cervical mucus check, where you check your ovulation, the basal body temperature, and the rest of them. Those are the natural types of family planning method. But then we have the hormonal and the non-hormonal methods, and that is what we're going to be discussing. I will start by explaining the non-hormonal family planning methods. When I say non-hormonal, I mean the ones that have no effect on the hormones. They include condoms, where we have male condoms, we have female condoms, the use of diaphragms, the use of spermicides. Spermicides are in form of cream. They kill the sperms. Even the sponge, you have the sponge type. They simply kill the sperm cells when they come in contact with them during intercourse. Then we have IUD, intrauterine device. Intrauterine device is a T-shaped device that is inserted into the woman's uterus through the vagina, the cervix, and then in the uterus where it stays. So this IUD, you have the copper releasing IUDs, which releases copper. So how does this IUD help in preventing pregnancy? IUD releases copper, which is toxic to sperm. So when intercourse occurs and the man ejaculates into the woman, the IUD there begins to release this copper that attacks the sperm cells and kills the sperm cells. So the sperm won't be able to get to the egg and fertilize the egg. This is one way it prevents pregnancy. Another way is it causes inflammation on the uterine lining, making them to become thick. So even if one sperm cell manages to get past the IUD and fertilize the egg won't have a suitable environment to implant on and develop into a baby. So implantation will not occur. That is how IUD works. IUD destroys the sperm, thereby preventing it from getting to the egg, and also causes inflammation on the uterine lining, preventing implantation. IUD is non-hormonal, which means it has no effect on the hormones, and IUD can stay for as long as 5 years. So these non-hormonal contraceptives are also known as barrier methods. They have no effect on the hormones, which means you can return back to fertility once you take them out. So do non-hormonal family planning methods cause infertility? The answer is no. Now let's talk about the hormonal family planning methods. Which is the family planning methods most of the women asking me these questions in the comment section we're using? So when we talk about hormonal family planning method, I always have these 3 questions to ask. The first one is, what type of hormonal family planning medication did you use? How long did you use it? That is, did you use it for a long period of time at a stretch? Did you use it for years at a stretch? Then the third question is, did you abuse this drug? Did you use it how you were supposed to use it? Because some people abuse these drugs. We have different types of hormonal family planning methods. We have the injectables, we have the oral contraceptive pills, we have the emergency pills, we have the implants, and the rest of them. Let's say, for instance, the emergency pill. The emergency pills, just like the name implies, emergency, is only given when an emergency occurs. Maybe a woman who has been sexually assaulted or molested can be given these emergency pills just to make sure pregnancy won't occur out of that traumatic experience. Or a lady who had intercourse with her partner and the partner used condoms, but then during the process of the intercourse, the condom broke and the man ends up ejaculating into the woman. The woman can take these emergency pills just to make sure pregnancy won't occur. Or for someone who has been using the oral contraceptive pills but then missed taking the oral contraceptive pills for some time and ends up having intercourse, the person can take this emergency pill just to make sure pregnancy won't occur. But when we talk about abusing this drug, especially these emergency pills, some people end up taking it all the time. You see women who take these emergency contraceptive pills every day. Some take it 3 times in a week. They end up abusing the drug. It is only used for emergency. It is not an oral contraceptive pills that you can just be taking if you're sexually active. You take it when there is a case of emergency. Some people even end up taking so many tablets at once because according to them, they just want to be sure pregnancy won't occur. So if they were asked to take 1 tablet, they end up taking 3. Some people even turn the emergency contraceptive pills as their own contraceptive pills, like they take it every time whenever they have intercourse. So what happens when this drug is abused? Certain hormones which are found in other types of hormonal contraceptive medications like progesterone are added in high doses in these emergency pills. That is why it is called emergency pills. So when you end up taking it frequently, more than expected, you end up introducing high levels of these hormones into your system, and it's going to alter ovulation. Because this emergency pill, what does it do? It actually suppresses and delays ovulation for a period of time. Your fertility is expected to return after 1 month of taking this drug. So when you end up taking it frequently, your body will become used to not ovulating, used to the ovulation being suppressed. So the second hormonal contraceptive we have is oral contraceptive pills. These pills can be combined, that is, it may contain progesterone and estrogen, and it works by inhibiting the release of FSH and LH, that is the follicle stimulating stimulating hormone and the luteinizing hormone, thereby suppressing ovulation. It prevents follicular development, that is, the follicles are not going to be able to develop, and then ovulation will not occur. These pills are taken daily for a specific period of time, and your fertility is expected to return 3 to 6 months or at most 1 year after discontinuing the medication. Another type of hormonal contraceptive we have are the injectables, where we have Depo injection, that is a 3 months injection. Your fertility is expected to return between 6 to 12 months after discontinuing the injections. So how does these injectables work? That is the Depo injection and the rest of them. How do they work? How do they prevent pregnancy? They do this by slowly releasing the hormone progestin into the blood, which prevents ovulation and thickens the cervical mucus. I explained about the cervical mucus. During ovulation, the cervical mucus is supposed to be egg white and stretch. You can stretch it in between the fingers and it will stretch. That is how to know a fertile cervical mucus during ovulation, and it's going to help the sperm cells to swim through them and get to the fallopian tubes and fertilize the egg. But these injectables will make the cervical mucus to become thick, thereby making it very difficult for the sperm cells to swim through them and get to the fallopian tube to look for the egg and fertilize the egg. Then secondly, it prevents ovulation. It inhibits the follicle stimulating hormone and the luteinizing hormone, the two hormones that are responsible for ovulation, thereby preventing ovulation. That is how these injectables work. We have another type of hormonal contraceptive, that is the implant. We have the Implanon, which can stay for 3 years, and Jadel, which can stay for 5 years. So how does this implant work? How do they prevent pregnancy? Implants are rod-like devices that goes under the woman's skin. It slowly releases the hormone progestin into the woman's blood, which prevents ovulation. These implants prevent pregnancy by doing these 3 things. First of all, it thickens the cervical mucus, thereby preventing sperm from being able to swim through it and get to the fallopian tube to fertilize the egg. It makes the cervical mucus to become thick. Then secondly, it prevents ovulation by inhibiting the two hormones responsible for ovulation, the follicle stimulating hormone and the luteinizing hormone, and this prevents follicular development and ovulation. Then thirdly, it makes the uterine lining to become thin, thereby making it an unfavorable environment for a fertilized egg to implant on and develop into a baby. So it makes the cervical mucus to become thick. Sperm won't be able to swim through the cervical mucus and get to the egg to fertilize the egg. But if the sperm manages to get through the cervical mucus and get to the fallopian tube to fertilize an egg, it won't see any egg to fertilize because ovulation will be prevented. Then if peradventure ovulation occurred and an egg was released, it will fertilize the egg, but then the uterine lining will become thin, and that fertilized egg won't find anywhere suitable to implant and develop into a baby. Now that you have understood how these hormonal family planning methods prevent pregnancy, let's get back to the question of, can hormonal family planning methods cause infertility? Family planning methods do not cause infertility, but they can prolong the time the woman is going to get back her fertility to get pregnant. So when you use these hormonal family planning methods for a long period of time at a stretch, for example, this 5 years family planning method, 3 years family planning method, or even the injectables, the oral contraceptive pills, all of them, and you take them for an extended period of time. Remember, these are hormonal drugs and they affect the hormones. What happens? The hormones in the body are going to become so used to being stopped from ovulating. The follicle stimulating hormone, the luteinizing hormone, the gonadotropins, all the hormones that are responsible for fertility, they have all been suppressed for a long period of time. Now they have become used to remaining at that level. In fact, it's almost as if they have forgotten that they are supposed to cause ovulation to occur. That is what happens when you use these hormonal drugs for a long period of time. After taking the hormonal contraceptives for a long period of time and you discontinue them, the hormones responsible for ovulation still feels like they are still under these contraceptive pills. And for some people, it takes a longer time before these hormones will regain themselves and begin to function normally again, making the woman to conceive again. Now remember, the fertility strengths of women are different. For some women, once they get off these family planning drugs, even the 5 years family planning, the 3 years, all of them, once they get off them, they can get pregnant instantly. For some women, using the oral contraceptives, if they miss a dose, they can get pregnant. So women have different fertility strengths, but because it works for other women doesn't mean it's going to work for all. So this is a piece of advice from me. I'm not here to scare you off from hormonal contraceptive, but if you have intentions of getting pregnant, let's say you had a baby this year and you want to have your next baby in 2 years time, I'm not going to advise you to use the hormonal family planning method. You can explore the non-hormonal methods, the natural methods, because you get your fertility back almost immediately after you discontinue the family planning. But for hormonal family planning methods, they take a longer time before you get your fertility back. So if you have intentions of getting pregnant again, maybe you just had your first baby but then you don't want to have another one till 2 years, explore other types of family planning methods that are not hormonal. Or for young ladies who have never been pregnant before but they are looking for a birth control method, I won't advise you to use the hormonal contraceptive method. Rather, explore the non-hormonal contraceptive method so you can get your fertility back almost immediately when you're ready to conceive. So you can use hormonal contraceptive methods but only for a short period of time and for the right purposes. Like for emergency pills, you can use it when there is an emergency. The Depo shots, you can take it the first 3 months, the second 3 months you discontinue. The oral contraceptives, you can take it for a year, you discontinue before the year you're ready to get pregnant. So you stop taking it before you enter the year you're ready to get pregnant, so you can get your fertility back by the time you start trying to conceive again. Also, hormonal contraceptives are a good option for women who are done with childbirth. Let's say you've had the number of kids you want to have, hormonal contraceptive methods are okay for you. So what do you do after getting off these hormonal family planning methods and you've not been able to get pregnant? Let's say you've tried for a period of 12 months and you're still not able to conceive. What you should do is to go to the hospital. You're going to need to run some fertility tests, do progesterone tests, do FSH and LH tests, check the prolactin level, just do all the fertility tests, the complete hormonal assay, just to know the levels of the hormones that are responsible for fertility in your body, so you will know the hormones that have been altered with. This will direct you in the right treatment option for you, and then focus on correcting that hormone and you're going to conceive. There are several drugs, several medications for each of these hormones if any of them has been altered with. Let's take for instance, if it's the follicle stimulating hormone and the luteinizing hormone, that is the FSH and the LH that has been altered with, you have drugs like clomiphene citrate, clomid, letrozole, and the rest of them. I have a video I made on clomid, how to take clomid. It's a good drug that can be used to correct the levels of this FSH and LH if they have been altered. So the bottom line is to go to the hospital, see your physician. You'll be asked to do this fertility test. If all the hormones are okay, you'll be asked to do pelvic ultrasound scan, HSG, and the rest of them, just to be sure everything is also okay. No fibroids, endometriosis, blocked fallopian tubes, ovarian cysts, and the rest of them. So these investigations are going to help your physician to know the right treatment option for you. So with this, we've come to the end of today's video, and I hope I was able to answer your questions. If you enjoyed watching, please do well to give this video a huge thumbs up, subscribe to my channel, leave a comment in the comment section if you have any questions, and I'll be there to respond. Turn on your notification bell because I have more informative and educative videos coming your way on this channel. This is it for now. Stay tuned and see you in my next one. Bye.